Thanks for staying with us here on The Real Story. Connecticut's DCF has reunified thousands of families over the past few years, but the need for foster parents and resources is still high. Joining me now is Danny Reyes, a foster care supervisor, and Elizabeth Saez, a training social worker who licenses foster parents. Thank you both so much for being here with us.
Thank you for having us.
So Connecticut has actually been recognized nationally over the past few years for reuniting a lot of families and reducing the number of children in the foster care system, and the state has been called a model for the nation. So whichever one of you wants to start, tell me a little bit about what that looks like within DCF and what's been working here.
So the biggest piece with DCF is really looking to when not utilizing DCF as a placement for children. So when we think about placements and kids coming to care, it really should be very short term. Okay. Getting them back to familiar settings, getting them back home, getting them back reunified is really our main goal. If we need to take a kid, it should be for as minimal as possible, and then to get them back to where the communities and the families that they came from.
And why is reunification such a big priority for DCF, either Elizabeth or Danny?
I was going to say, you know, for me, it's families should be raising their own children, right? Kids want to be home with their family, so that is really so important to the kids, especially when you are caring for them, right? I'm a mom, so I know how important it is to raise my own child. So sometimes, you know, families need help, and that's why DCF, when we get involved, we try to help kids by maintaining and supporting their family and not just a child.
And what is, oh yeah.
I just want to clarify something too. Yeah. So when we get involved, our goal isn't to remove the child either.
Right.
So our goal is to, if a family's intact, to work with that family. So we are preventing the removal. So we are helping them be able to sustain without the department's assistance moving forward. And that would be looking into the community, looking at service providers to see how we do that. So I want to just clear, like, we're not looking to remove. Right. Our goal is really to keep that family intact. But if it comes down to the removal, how can we do that as minimal as possible, so that the time that they're in our care is not long?
Gotcha. And what do some of those services and supports look like when it comes to supporting the entire family and keeping them together? What are some of the things that DCF does or provides to these families?
Well, I'm going to say that one of the first things we try to do is try to connect them with relatives, kinship, right? So try to find families that maybe can be of support prior to the child having to be separated from their family. So we try to do that work first, right? So provide services to the families in the home and try to connect them with relatives that maybe can be a support, maybe to the family by transporting the child or providing some care. If the child does need to come into care, we do try to assess the relatives so that the child does not have to come into core families and then goes into relative care straight. So it could be going from their birth family straight into kinship care.
Gotcha. Yeah. Anything to add there, Danny?
Yeah, I mean, the big thing is to find what's within their community that can support them. And sometimes they may not know what they're able to access. And if we are, it's again building up the communities to really support our families.
Right. So your commissioner, Vanessa Durantes, just announced this past week that she'll be stepping down to pursue a new opportunity. But, you know, she was a major part of this strategy to shrink the foster care population. And this past week, both she and the deputy commissioner, who's now been nominated to become the next commissioner, spoke specifically about how poverty shouldn't be a reason kids are taken from their families. How often are you seeing that be a factor here in Connecticut? Poverty is a factor in these families.
I mean, I don't know specifics, but I know that poverty doesn't equal neglect. And I think that's what needs to be very clear, is just because you can't pay a bill or you're struggling with something, that doesn't necessarily mean neglect. So that doesn't mean that you are not fit to be a parent. So again, I go back to this, and I will go back to this. How do we build up the community? How do we strengthen? The community could also be within that family, their relatives, their family members, the neighbor down the street. Like, how are we helping them recognize supports within their own system, and that it's okay that they reach out to their own support network as well.
Yep. So obviously there are kids who do end up needing protecting or needing to be cared for by someone other than their family. So there's still a pretty big need for foster families and parents here in Connecticut, right?
Yes.
Yes.
And what has that need been looking like? Has that grown over the past couple years?
So I think just to be what we try to do first, so when a child gets removed, our first is, can we look within the family to license somebody within the family?
Okay.
Is it an aunt? Is it an uncle? Is it a coach? Is it something that's familiar, someone familiar to the family and that child, to see if we can first support them in, again, if they're being removed, can we keep them within their same community as well?
Within someone they know.
Within someone they know while we work to get them back home. And that's, if we can't get to that point or no one's been identified, then we look for what we call our core foster care. So someone who's non-related who comes in to want to open their home to support these youth. But also the important piece of this is what we're really looking for, someone who's willing to work with the birth family so that we can work on that reunification.
Right, right. And both of you don't just work with children here in Connecticut. You've both actually gotten personally involved and brought that work home. So I'll start with you, Elizabeth. How did you get into fostering, and what has your experience been like with that?
I started as a relative caregiver. That's how I started. A family member, needed me at that time, and I was like, absolutely, family first. And so that's why I'm so huge in family, working with birth families is important. But that's how I first started, and then my best friend decided she wanted to adopt, and I was like, yeah, I'll be your backup. And that's how I've started, and ever since then, that drive to help families, right? Like I helped my own relative. I was like, I can do this for another family, help them out, work with the birth parents, work with the fathers. So it's not just moms, I work with dads, grandma, paternal, maternal side. So pretty open to working with extended family, and birth family. I think kids do better, they thrive, they're happier. There's not that infighting with the kids, picking one side. It's like, you know what I'm saying? So they can love you and they can love their families too at the same time, because we're supporting and we're talking to each other. I think that is important, that families that want to be foster parents, that they're open to maintaining those family connections, because those are important.
And Danny, you're actually an adoptive parent, correct? Can you tell me a little bit about that?
Yeah, so my then husband and I adopted. We wanted to grow our family, and we then adopted. We didn't go through DCF. We went through a private agency. But through our journey and with our daughter, the important piece is we have a very good relationship with her birth family.
Oh, okay.
Her mother, her brother. We have a very good relationship with the birth family. So it's very important in this role that I'm in now. I take it kind of to heart, where how do we then do that same with the families we work with, is that relationship with the birth families is so important. That relationship with the birth parents, the mother, the father, is very important, because that's what's going to help the kid thrive. And like Elizabeth said, they shouldn't be feeling they have to choose between a current temporary home versus their biological parents. We should be working as one, and we should be centering around and focusing around that child.
And for either of you here, when we talk about getting people more interested in being a foster parent or opening their home as a foster family or being an adoptive parent, for those who are on the other side, for those who might need to seek DCF and need a little bit of help, is there anything you say to them, or how do we get rid of potentially the shame or the fear of asking for help, of seeking out DCF and maybe saying, I do need support here?
I think
Too big of a question.
I think that's the $1 million question, because I think I know that there's an image sometimes that the community feels towards about DCF, and we have continued to try to change that image, and really our focus is building up that community, building up the supports, building up that family, building up those parents to know that we're here to really work with them. We don't want their children. We want them to be an intact family and have the tools necessary to kind of be able to go on without us. And yes, maybe there was a short term where you needed us, but how do we get beyond that? And how do we know that we were there to help you in that meantime so that we can move on?
Yeah. And when it comes to the support needed for these kids after they turn 18, because I think a lot of people sometimes have that narrative and have that image that, you know, if they're getting that support once they turn 18, they're an adult, they don't, you know, need that help anymore. But that's not the case. So, you know, Connecticut is a little bit different here. What are some of the supports available to kids and people after they turn 18?
So when someone does turn 18, we're not kicking somebody out of foster care. So let's get rid of that really quickly.
Yep.
The other piece of this is when they turn 18, what we've hoped is the work that we've done prior to them turning 18 is that we built some level of a support network for them. Okay. So is there a friend that they can live with? Is there a cousin that they can live with, an aunt? Or have they rebuilt their relationship with their parents and they're still building on that? And where can they have maybe a room to rent, or, you know, and help them with college and other pieces of that, and whatever their secondary education plan. Not everybody's geared for college. So sure. What other opportunities? Is it going right into the workforce? Is it looking at a trade school? Mm-hmm. So looking to see how we can support them to be able to function and survive in the community on their own as well.
And for Elizabeth, for those who might want to get involved as a foster parent, be a foster family, what makes a good foster family, and what should they know about if they're considering getting involved?
Do you have love in your heart? Do you like kids? Do you like working with families? Do you have space in your house, right? Are you in general good health, right? So come to us. I would say come to us. Let us kind of like work with you, talk to you about what we offer and the supports that we have. I mean, we need families that are open to children from 0 to 21, 22. I think at this point, 22. Yeah. And I've taken kids from newborn to 20. So,
wow.
Yeah. So, you know what? They're all great. I specifically like adolescents. So those families that are open to taking adolescents, we would love to have you. They need love just like babies, right? Yeah. They need support. They need guidance. But yeah, so I would say, if you have patience, you have love, you have space in your house, come talk to us. We need you.
And last thing here, I'll start with Elizabeth and then go to Danny. You know, we mentioned a couple times throughout this conversation about maybe some of the narratives or images people have about DCF in their minds already. What do you wish people knew about DCF and about this work?
That DCF is here to help families and to keep families together. We're not here to rip families apart, right? We're here to help. We try to preserve families, and if not, we can't preserve them, to at least reunite them whenever possible. That's not always possible, but that's our priority, right? To try to keep families together. And I think sometimes people have this negative image of us of tearing families apart, and that we're not here to help.
For me, sometimes it takes a team or a village. And so to realize that we can be part of that village, even if we're there short term. So how can we do that? We're in the communities with you guys as well. So how can we get that? How can we get to there? How can we help build your family up, and whatever that may take? And you know, there's always more information also on our website, ctfosters.com. So that's also where people can come and get more information as well.
Perfect. Well, Danny, Elizabeth, thank you both so much for being here with us.
Thank you so much for having us.
Thank you.
Of course. Well, that does it for us here on The Real Story. But if you want to watch these segments again, you can head to fox61.com or download the free Fox 61 News app and watch The Real Story every Sunday at 10 a.m. right here on Fox 61 and streaming on Fox 61 Plus. Have a great morning.